you can see this is the bicep tendon. This is the lateral side, this is the medial side. So it corroborates with the right side. Okay. So this is medial side, this is lateral side. So this is laterally and medially. By you can see there are two muscles. One is semimembranosus, and over which we can get the semitendinosus. Semimembranosus and semitendinosus. And below you can see there is one muscle which has got two tendon of origin, that is the gastrocnemius muscle, which is the which forms the muscle bulk of the cuff. Okay, so that is the gastrocnemius muscle below, which has got medial and lateral heads. Along with, on the lateral side, one muscle is peeping, that is plantaris. On the lateral side, from the lateral side, it goes to the medial side. So this is plantaris. So medial head and lateral head of the gastrocnemius and the plantaris, which has got rat tail appearance. Plantaris has got rat tail appearance. You can see the very thin muscle which ends in tendon. So this is the area which is called the popliteal fossa. Within the popliteal fossa, we can expect the popliteal vessels and tibial nerve and common peroneal nerve. Okay. So let us see those structures. So and the floor, you can see it is formed by the popliteal surface of the femur, and below you can see one muscle, that is popliteus, under the coverage of the there is fascia, which is called fascia covering the popliteus. Okay, popliteus muscle you can see, which is this is a tendon-like appearance. Okay, which goes from here to this part. So above the soleal line of the tibia, we can get the popliteus muscle. Okay, so this is a rhomboid shaped area, and we can see this is the popliteal surface of the femur, below by the popliteus muscle, and just behind the knee you can see one ligament which is called the oblique popliteal ligament, which is an expansion from semimembranosus muscle. Okay. So these are the contents. These are the contents. Actually, we can see from medial to lateral part in the upper part of the popliteal fossa, we can get the popliteal artery, popliteal vein laterally, and most laterally, that is tibial nerve, and absolutely on the lateral side there is a common peroneal nerve. So nerve, vein, artery, NVA, nerve, vein, artery, and they are crossing. Just look there, they are crossing. Okay, actually the nerve crosses the vein, and also it crosses the artery, and ultimately it becomes medial most in the lower part. Okay. Similarly, the vein which was lateral, which also crossed just behind the knee, it crossed the artery and it takes a medial side of the artery, and this is the artery. So in the lower part, nerve, vein and artery. In upper part, nerve, vein, artery. Okay. So this is the relation of different structures, and most laterally we can see this is the common peroneal nerve, from where one nerve is coming out, and from here, from the tibial component of the sciatic nerve. Okay, this is the tibial nerve from where another nerve comes out. You can see in the body that is the sural nerve. Sura means leg. Okay. So these are the contents of the popliteal fossa. So these are popliteal artery which has got medial genicular, lateral genicular branches, upper medial genicular, lower medial genicular, upper lateral genicular, lower lateral genicular, and middle genicular. These are the branches which forms a arterial anastomosis around the knee. Okay, we will learn gradually. So that is the most important clinical anatomy, that is a popliteal artery aneurysm. Okay. So you know the Sir Hunter invented one technique. He was a surgeon. Actually, the popliteal artery, what is popliteal artery? Nothing but the femoral artery which when passes through the fifth osteoaponeurotic opening of the adductor magnus, it becomes a popliteal artery. So we know the adductor canal, we have seen the adductor canal, femoral triangle, adductor canal. So in popliteal artery aneurysm, the artery is tied in the adductor canal. Okay, and then this the correction of the aneurysm is done. So this is the tibial nerve which has got so many branches like lateral head, some branch is given to the lateral head of the gastrocnemius, medial head of the gastrocnemius, plantaries. Okay, these are this is the sural nerve, and these are the other nerves which we will see in the leg today. Okay, so that is it will give branch to the Soleus, Tibialis Posterior, Flexor Digitorum Longus, Flexor Hallucis Longus, and ultimately it divides into medial and lateral plantar nerve, which appears in the sole of the foot. Okay, we can see in the sole of the foot, and other the genicular branches. So medial genicular, medial upper genicular, medial lower genicular, middle genicular, these are the branches. But the lateral genicular branches are actually coming from the common peroneal nerve. You can see the common peroneal nerve, which ultimately divides into, you can see superficial and deep at the neck of the fibula. And we can see upper lateral genicular, lower lateral genicular, okay, lower lateral genicular, upper lateral genicular, lateral cutaneous nerve of the calf. You can see in the cadaver also that is a lateral cutaneous nerve. But unfortunately, we are not getting the sural communicating nerve which communicates with the sural nerve in this cadaver. So this is the arterial anastomosis. Okay, it is contributed by this the arteries, that genicular arteries and fibular arteries. Okay, so we will learn. This is the different compartments of the leg. Today we are concerned with this compartment, that is the posterior compartment. We have already, this is tibia and this is fibula. So this is the anterior compartment. Interosseous membrane in between tibia and fibula. This is the lateral compartment, anterior compartment. So we have already come across with these compartments. So this is the posterior compartment. So here you can see just below the skin one nerve, one vein, that is sural nerve and small saphenous vein. This is the deep fossa and this is the deep transverse fossa. So from superficial to deep, we can see several muscles. Okay. On superficial plane, we can get the gastrocnemius along with soleus. Okay. This is gastrocnemius, this is soleus. In the next compartment, medially we can get the Flexor Digitorum Longus. On lateral side, we are getting Flexor Hallucis Longus. And most at the posterior plane, just behind the interosseous membrane, we can get this muscle, that is the Tibialis Posterior. Okay. And in between two plane of muscle, we can get this artery and this nerve. Artery is nothing but posterior tibial artery. Actually, rather we should call it as posterior tibial vessels, because the deep artery is accompanied by the veins. Okay, so that is the posterior tibial vessels, and this is the tibial nerve. And on the lateral side, we can get another artery which is nothing a branch from this artery. This is the posterior tibial artery. From here, we are getting one branch which appears in the lateral side, which is called the peroneal artery. Sometimes this branch is thicker than the tibial artery. Okay, actually the daughter become voluminous than the mother. Okay, the mother is the tibial artery. So here we can tibial artery, tibial nerve. We can see. So here you can see that the superficial vein from the lateral side of the dorsum of the foot, we can see there is a continuation just behind the lateral malleolus. That is, we can get this vein, which is nothing but the short saphenous vein or small saphenous vein. Okay. So this is continuation of the lateral. There is one venous arch, dorsal venous arch in the foot. Okay. So its lateral continuation is actually the small saphenous or short saphenous vein. And along with, we can see one nerve is coming out. Okay. That is the sural nerve. So that is the sural nerve. Okay. Actually, it comes out from the, you will see it is coming from the tibial nerve. And another nerve which is coming from the common peroneal nerve. Okay, that is the sural communicating nerve. So we can, in the superficial structure, superficial dissection, we can get this nerve and the vein. So these are the structures we can find. This is we can get one. We know the flexor retinaculum in our hand, flexor retinaculum. Similarly, here we will get a flexor retinaculum in the ankle. Okay. So behind the flexor retinaculum, there is a passage between the bone and the flexor retinaculum. So that is called the Kota Pis. Kota means port. Pedis means pedis, pedicure, manicure, foot. So Kota Pis. Okay. So here we can get several muscle tendons, vessels, nerve. From medial to lateral, we can get Tibialis Posterior, Flexor Digitorum Longus, then posterior tibial vessels, tibial nerve, then Flexor Hallucis Longus. Okay, this is the Flexor Hallucis Longus. You can see this tendon is going to get inserted in the distal phalanx of the great toe. So that is hallux or the great toe. So this is the Flexor Hallucis Longus. And Flexor Digitorum Longus, you can see also, we can see Flexor Digitorum Longus, actually it goes to the lateral 4 digits flexure. Okay. So these are the structures. So there is one mnemonic in Bengali by is very funny mnemonic by which you can remember the structures. Any can বলো বলছো হ্যাঁ Tom, Dick and Nervous Harry. In English, Tom, Dick and Nervous Harry. Tom means Tibialis Posterior. Tom, Dick. Dick for digitorum. Artery. And Tom, Dick and Nervous. And means artery. Artery and vein. Tom, Dick and Nervous means nerve. That is tibial nerve. And Harry means Hallucis Longus. Tom, Dick and Nervous Harry. And in Bengali, টিকটিকির ডিম টিকটিকির ডিম ভেঙে আমি ভীষণ নাকাল হয়েছি আমি বলেছি না যখন আমি বাংলায় বলি তখন মজার কথা সো ইফ ইউ ওয়ান্ট টু এনজয় দিস ইউ হ্যাভ টু লার্ন বেঙ্গলি দোজ হু ডু নট আন্ডারস্ট্যান্ড বেঙ্গলি তো টিকটিকির ডিম ভেঙে আমি ভীষণ নাকাল হয়েছি টিকটিকির ডিম যদি ভাঙি তাহলে সত্যি নাকাল হবো তো হবো না হবো তো এটা টিকটিকির ডিম ভেঙে ফেলেছি কি বিচ্ছিরি ব্যাপার তাই না টিকটিকি টিবিয়ালিস পস্টেরিয়র ডিম মিন্স Flexor Digitorum Longus. ভেঙে আমি ভীষণ vein artery vein. Vein means the posterior tibial veins. ভেঙে আমি ভীষণ আমি means artery. That is posterior tibial artery. ভীষণ নাকাল হয়েছি নাকাল নার্ভ tibial nerve হয়েছি means Flexor Hallucis Longus. ঠিক আছে vein artery আছে ওর সঙ্গে লেগে আছে এখানে দেখতে পাবে এই নিউমোনিকটা আমাদের শিখিয়েছিলেন সুমিতা ম্যাডাম যার ছেলে খুব বড় একজন মানে ফিল্ম ডিরেক্টর সৃজিত মুখার্জি বাংলার সিনেমা জানো সৃজিত মুখার্জির সিনেমা সে তখন সৃজিত মুখার্জি আমার থেকে একটু হয়তো কম বেশি বড় ছিল তখন সে সৃজিত মুখার্জি হয়নি তখন ম্যাডাম 92 সালে এটা শিখিয়েছিলেন টিকটিকির ডিম অসাধারণ পড়াতেন ম্যাডাম সুমিতা মুখার্জি সুমিতা সরকার সো দ্যাট ইজ টিকটিকির ডিম ভেঙে আমি ভীষণ নাকাল হয়েছে সো টম ডিক অ্যান্ড নার্ভাস হ্যারি so you can see the muscular components from superficial to deep we can see the most superficial that is we can see the gastrocnemius medial and lateral head of the gastrocnemius which ultimately ends in a tendon you can see this and attachment is at the calcaneum in the posterior part of the calcaneum we can see there are there is a rough area for attachment of this tendon. This tendon is also called Achilles tendon. It has got one historical importance. Okay. So that is gastrocnemius. You can see the gastrocnemius. If we remove the gastrocnemius muscle, we can see at sole-like muscle. Sole-like. Sole mane? What is sole? Sole of the foot. Sole of a shoe. So it looks like sole of a shoe or sole of a foot. So it is soleus. So this gastrocnemius muscle, just below the gastrocnemius muscle, we get this soleus, and we can get this tendon. Actually, soleus and gastrocnemius, these two heads, that is the medial and lateral head of the gastrocnemius, joins with this soleus, and ultimately we get this tendon. So this muscle bulk is called triceps, three heads, two heads of gastrocnemius and soleus, three. Triceps surae, surae means leg, triceps surae. And this soleus, in the soleus, you can see there you can get the venous network, the deep veins, from superficial veins, okay, to deep vein. There is a communication, and here we can get the venous network, okay, within the soleus. So when this soleus muscle contracts, what happens? The blood from superficial veins enters into the deep vein. So it acts as a pump. So pump in our body is called heart. So it is also called the peripheral heart. Soleus. Soleus is called the peripheral heart. So venous sinuses or venous network we can get. Okay. There are several venous sinus in our body. Okay. Gradually you will know. So this is the soleus. So these are some clinical condition. Okay. The tennis, leg, Achilles tendon, tendinitis, Achilles tendon rupture. Actually, the tendon is affected sometimes. Okay. Actually, tendinitis is a misnomer. Actually, there is one bursa in between the calcaneum bone and this tendon. That bursa is affected. So, tendinitis, that it is not that the tendon is affected. Okay. And tendon rupture can happen. It is not very uncommon. Okay. Especially seen in Western type of, we know there are Eastern type and Western type of the Western type is the common, and Eastern type of disease we can see where we have to sit. There is a squatting position. We have to sit in a squatting position. Sometimes leg may go inside the hole and there might be a rupture of this tendon. So this tendon is devoid of blood vessels. So healing of this tendon takes long time. So you can see most superficially gastrocnemius, then soleus. And if we remove both gastrocnemius and soleus, what we can get ultimately, if we remove the gastrocnemius and soleus, then we can get on medial side, this is tibia, this is fibula, and this muscle is taking origin from the posterior surface of the tibia, and it ends in four tendons for the lateral 4 digits. and this causes flexion of the foot. So this is called the Flexor Digitorum Longus. That means there is one local muscle is there, that is Flexor Digitorum brevis. There is local muscle that is seen in the sole, but this is longus. So Flexor Digitorum Longus. Okay, so it goes within the Kota Pis. We have seen Tom, Dick, and Harry. Tom means Tibialis Posterior, then Dick, that is Flexor Digitorum Longus. And from the posterior surface of the fibula, we can see another muscle. So this is the muscle which divides into 4 tendons. Here we can see this another muscle which is taking origin from the posterior surface of the fibula, that is the Flexor Hallucis Longus. Okay, and it is the destination is the distal, the flexor aspect of the or the plantar aspect of the distal phalanx of the great toe. So it is called, it causes flexion of the great toe or the hallux. So it is called Flexor Hallucis Longus. And most interesting, there is one interesting point to note. The muscle bulk of Flexor Hallucis Longus is more than the Flexor Digitorum Longus. Okay, this is bulkier than the Flexor Digitorum. Okay. And one muscle you can see in between this is Flexor Digitorum and this is Flexor Hallucis. Okay, and in between, that means this interosseous membrane and from part of the tibia and from the part of the fibula, we get another muscle. Okay, at the most posterior plane, that is Tibialis Posterior. Tom, Tibialis Posterior. So that Tibialis Posterior is at the deepest compartment. It resides in the deepest compartment, deepest part of the flexor compartment. Okay, so that is Tibialis Posterior, and insertion of the Tibialis Posterior is very interesting. It is mainly inserted at the tuberosity of the navicular bone. There is one navicular bone, you know, medial cuneiform, lateral cuneiform, intermediate cuneiform, navicular, like boat-like bone, one cube-like bone. There are tarsal bones are there, so that we are getting the navicular. So it is inserted mainly at the tuberosity of the navicular bone, but from there we get several finger-like projections are coming out, and these finger-like projections actually they are attached to all tarsal bones and also second, third and fourth metatarsal bones. Okay, so this is the peculiarity, that is mainly attached to the tuberosity of the navicular bone. From there, finger-like or tentacular projections are there, and these projections are inserted in all the tarsal bone except all the tarsal bones except the talus. What is the muscular attachment of the talus? Can you tell me? Yes, no muscle is attached to the talus. Very good. So that is, except talus, it is the projections are attached to all the bones. So it is causing flexion and also inversion, the prime inverter. Okay, the prime inverter, that is Tibialis posterior. Okay, so this is the Tibialis posterior muscle, you can see. Okay, here we can see, and we can see feather-like appearance, unipinnate muscle. Tibialis posterior. And also in between superficial and deep muscles, in our forearm, the superficial group of muscles and deep group of muscle, in between we are getting vessels and nerves, like on the radial side, radial artery, on the medial side, we are getting the ulnar artery, on the lateral side we are getting the radial artery, also we are getting the median nerve, radial nerve. So they are in between two muscle planes, superficial group of muscle and deep group of muscle. So here in between two group of muscles, that means Triceps Surae, and deep group means Flexor Digitorum Longus, Flexor Hallucis Longus and Tibialis Posterior. They are a deep group of muscle, and superficial means Gastrocnemius and Soleus. In between we are getting neurovascular structures also here, and important one is the artery, which is actually the popliteal artery divides into anterior and posterior branch, that is anterior tibial and posterior tibial. This is the interosseous membrane. Just above the interosseous membrane there is a gap through which the anterior tibial artery comes out, it enters into the anterior compartment. And here we are getting the posterior tibial artery. And you can see the posterior tibial artery, this is the continuation of the posterior tibial artery, from where we are getting one branch, which is the peroneal artery, peroneal or fibular artery. Peroneal means fibular compartment is called the peroneal compartment. So peroneal artery. Sometimes this peroneal artery is voluminous, okay, than the tibial artery. Ultimately, this tibial artery divides and enters into the sole as medial and lateral plantar arteries. Similarly, we can get the tibial nerve, okay, that also divides into, ultimately divides into medial and lateral plantar nerves and enters into the sole. So this is here this posterior tibial artery pulse is very important. We can feel behind the medial malleolus. What is medial malleolus? There is a projection. Behind the medial malleolus of yours, you can feel one arterial pulsation. Dekho, behind the medial malleolus, you can feel one arterial pulsation. That is nothing but the posterior tibial artery. Okay, that is arterial pulsation of the posterior tibial artery. There are several arterial pulsations, radial artery. You can see pulsation in the radial artery. You can see the pulsation in the carotid artery in the neck. You can see the femoral artery pulsation in the groin. You can feel the pulsation of posterior tibial artery pulsation, and it is affected in Buerger's disease. the peripheral artery disease. Okay, Buerger's disease. So ultimately, if the artery is affected, then there will be formation of dead tissue, that is gangrene. Okay. So we can get the tibial nerve also. Tibial continuation of the tibial nerve, which will supply all the muscles. এই কম্পার্টমেন্টে কারা আছে? Posterior compartment, flexor compartments. So in the flexor compartment we can get the flexor muscles. So it will supply the flexor muscles. On the superficial plane we are getting gastrocnemius, so it will supply the gastrocnemius, soleus. It will supply the flexor digitorum longus, flexor hallucis longus, tibialis posterior, and it has got cutaneous branch also. Okay, that is sural nerve. Okay, and it will supply the joint also. So there are several branches. You can see tibial nerve from in the popliteal fossa. We are getting plantaris, lateral head of the gastrocnemius, medial head of the gastrocnemius, genicular branches, supplies popliteus. Then in the leg, this is the popliteal fossa, this is the leg, soleus, tibialis posterior, so and so, and ultimately divides into medial and lateral plantar nerves and enters into the sole. It supplies the sole. Tarsal tunnel syndrome, the same place is affected. Carpal tunnel, tarsal tunnel, tingling and pain, paresthesia, so and so you will get.